We just, like you said, got a brand new certificate. It's called the Undergraduate Certificate of Health Education and Promotion approved, and it's going to be kicking off in fall of 2025 for students to declare. It's composed of 12 credit hours, so 4 courses, and we really wanted to give students who are interested in community health work or want to start to identify ways that they can integrate health education and promotion into their future professional career an opportunity to hit on what we consider to be those really fundamental or core concepts which they would go through within those 4 courses. We have a lot of pre-health students at the university who don't have the opportunity to engage in these concepts that are really the social side of healthcare or medicine. And so for those students who want to do clinical practice but can't quite commit to being a community health major, we wanted to give this really nice package of what we consider to be those really core concepts that allow them to be mindful of health education, prevention, health program planning and assessment and evaluation, so things that will allow them to be better practitioners in the end, as well as doing that alongside their other coursework that they believe is going to strengthen them as a potential candidate for post-grad programs. It's composed of 4 courses, 12 credit hours, which is really nice and bite-sized for students who maybe have a really time-sensitive major or something that they want to do in terms of pre-health. So we know that pre-medicine has a lot of requirements to be eligible for medical school. So we wanted to make something that was more bite-sized for those kind of students that they could participate in either a year or 2 and not super stressful. Students would then enroll or declare the undergraduate certificate, which doesn't take a lot. They would then take the 4 courses, and to be eligible to receive the certificate at the end of those 4 courses, they just have to have a satisfactory grade of a C or above. It is designed for both, so anyone could take it. I will say for those who are full-time students and have not been in the professional field, it might be a little bit more beneficial because we have projects that are community service or community-based, meaning we're trying to get you out into the community, versus those who are already working might be dealing with these concepts in real time, but it does allow them to become more marketable or maybe refresh in some concepts that they haven't had formal training in previously. There's so many benefits to a certificate. It allows you, one, if you're going into the job market or a grad school program, to make yourself more marketable because you get to add something that you specialize in a specific content area. I think that's really great for pre-health students who need to diversify themselves or make themselves more competitive in a really big applicant pool that a lot of people tend to be the same major. So that's one benefit of the certificate. Another is that it allows you to fulfill a lot of the competencies needed for the Certified Health Education Specialist exam. And so if you're a community health major, you are eligible, and you are the only students who are eligible to sit for that exam at the end of your program because we fulfill those competencies. But for students who have fulfilled some through maybe their major, this may allow them to fulfill the full required amount of competencies to sit for that exam, which again makes you more competitive. And then lastly, it allows you to engage with different ideas and different student populations that your major may not be offering you. And so I think it just allows for a really diverse and exciting curriculum, and you get to get out into more of the Lawrence, Douglas, and Kansas City metro area doing community-based work through our courses and through our project. We're so excited about offering this. So these 4 classes have been part of the Bachelor of Science in Education for Community Health majors for years and years. Now what we're excited is to potentially diversify our classroom space, present that interdisciplinary environment for learning and students that we see in the community health field. And also we just want to make us more accessible to students who are interested in engaging in health education, health promotion, and community health work.